Hey everyone, Dr. Skylar Baku here, and in this video I really want to talk about being cold, okay, and sensitivity to being cold. All right, so now from a clinician's perspective, sensitivity to cold is usually a result of one or more of these factors, okay? So anemia, low thyroid, or poor fat metabolism, okay, or not enough fat, okay? Now often, you can see anemia in the lab work, okay, low iron, low HCT, low HGB, hemoglobin, all these things point to anemia. And many more times, the lab results are within our normal ranges, and yet the people I'm seeing, they're still complaining of cold hands and feet, and they might have the brittle nails, that peel, or they might be chewing on ice a lot, or eating ice and yawning all the time. So if they're dealing with any of that and they're looking pale to me, I'm probably going to treat them for anemia, regardless of the lab. A famous doctor once said, listen, there's a lot going on in the blood than just a few things we look for in the lab slip. So, makes sense. So we're going to be treating the patient, not the lab slip, okay? And a couple things I like to give for that. I use Ferrochel from Designs for Health, which is an iron supplement, or I like to use spirulina from Earthrise. Okay, Earthrise is just a very good brand. They produce nice, clean, safe spirulina, which, toxicity and poor quality in spirulina is a huge problem. So make sure you're getting a good, clean brand, and I like Earthrise. Okay, so magnesium is also super helpful because it helps to release stored iron in the liver, which makes it, again, available to the body. So also B12 can also be super helpful. I'm going to test for that because B12 anemia is also fairly common. So, when it comes to the next thing with hypothyroid, so low thyroid function, the classic signs are, your hair loss, your weight gain, the fatigue, morning headaches even, and even stiffness with inactivity. And often, the lab work is going to be normal, typically because they're not testing for it right, or they're only testing for TSH, and they're basing thyroid function on TSH alone, which, if you watch my other video about, how the thyroid works, I talk a lot about in there about how to properly test for the thyroid and what you need to be looking for that they often don't test on the blood work. Okay, so, if my examination in the treatment room suggests hypothyroid, and yes, we can help diagnose that in the treatment room, the lab is just there to help us to confirm our diagnosis. Okay, so if that's the case, I'm going to support them with some thyroid supplements. Okay, for instance, like I use Thyroidin from Innovita. That's one of my favorites. Something with iodine, maybe Algacal, is also super helpful. So and there's other things we can look at, maybe ashwagandha. Sometimes, again, if it tests well, that's what we're going to use to help with the thyroid, and especially even just with the Thyroidin alone. We see some amazing clinical response and results with that. And the last thing on the list of this three, are the fats. Okay, remember, so I rarely see this problem with men, typically because they're eating fats all the time, but it's usually the female trying to watch their figure and having a low-fat diet. So, ladies, you need to look no further than the walrus or the seal to see that fat insulates you against the cold. Okay, so eating fats don't make you fat. Bad carbs make you fat, okay? And sugars make you fat. So, and they also make you feel cold too. So do yourself a favor and find a good quality fish oil, okay? Or flax oil supplement, okay? I like to use cod liver oil, okay? Because there's a special little conversion that happens with the cod that I like, and I happen to use Nordic Naturals, okay? There's some other amazing fish oils out there too, but that's just the one I happen to use routinely in the office. So thanks so much for watching. Again, I'm Dr. Skylar Baku with Baku Chiropractic and Functional Medicine. And if you have any questions, please give us a call. Number is 720-998-7956.